Menopause is not a specific moment but a phase of life, characterized by significant changes in the body, accompanied by noticeable symptoms for most women. Menopause occurs when a woman has not menstruated for 12 consecutive months. Before and after this period, menopausal symptoms may still persist. It is called perimenopausal period. The hallmark of menopause is the cessation of ovarian function. It means the end of a woman's natural reproductive capacity. The most common age for menopause is 51 years, although it can occur anywhere from 40 to 58 years of age. Symptoms of menopause can last even longer. If we say what is the most important fact about menopause, it is dramatical decrease of sex hormones. Estrogens and progesterone. This deficiency of hormones causes all symptoms which are associated with menopause. Hot flashes are the most common symptom of menopause, affecting nearly 80% of cases. They are sudden feelings of warmth, most intense over the face, neck, and chest, with the skin reddening, resembling a blush. Hot flashes may occur several times a day. They are caused by dropping estrogen levels, which stimulate the hypothalamus, a cooling mechanism in the brain, to become more sensitive and inadvertently trigger the body's cooling system when it is not actually needed. Hot flashes are more prominent at night and can persist throughout the entire perimenopausal period. It means it can last for years. Perimenopause is the time before and after menopause occurs. This period typically lasts for 4 years, but can sometimes extend up to 10 years. The second most common symptom of menopause is night sweats, a manifestation of hot flashes that occur at night. They can be so intense that they may drench sleepwear or bedding. The mechanism is similar to hot flashes. Dropping estrogen levels cause the hypothalamus to become less accurate in temperature regulation, leading to an overreaction to heat, and thus cooling mechanisms are activated unnecessarily. Some women also experience heart palpitations during night sweats. Night sweats are almost as common as hot flashes. The third most common symptom is vaginal dryness, which occurs due to a lack of estrogen. This leads to the thinning of the vaginal walls and reduced lubrication. Initially, it affects around 30% of women, but after the age of 60, more than 60% of women may experience it. The fourth most common symptom of menopause is mood swings. Decreased levels of estrogen lead to fluctuations in serotonin levels, which is considered a feel-good neurotransmitter. Additionally, low estrogen levels stimulate the production of stress hormones such as cortisol, which can cause anxiety and irritability. On the other hand, progesterone has a calming effect on the brain, and decreased levels of progesterone can further contribute to stress and irritability. The fifth most common symptom is irregular periods. The fluctuation of estrogen levels makes menstruation irregular and unpredictable. Periods can become heavier or lighter, occur closer together or farther apart, or be entirely absent. After a period of irregularity, menstruation stops altogether, signaling the onset of menopause. Other symptoms that some women experience include urinary problems, decreased libido, brain fog, and weight gain. These symptoms are also related to low levels of estrogen and progesterone. Many women notice a change in fat distribution, with an increase in abdominal fat, even if their diet remains the same. This change is attributed to low estrogen levels. The most effective treatment for menopause symptoms is considered to be hormone replacement therapy (HRT). This involves the administration of estrogen, or a combination of estrogen and progesterone to compensate for the deficiency in sex hormones and dramatically relieve symptoms. However, the main adverse effect of estrogen therapy is an increased risk of endometrial cancer. When estrogen is combined with progesterone, the risk of endometrial cancer is reduced, but there is a slight increase in the risk of breast cancer. Overall, the combination of estrogen and progesterone is considered safer because the increased risk is minimal. These hormones can be administered as pills, patches, gels, or vaginal creams. The best approach to HRT is to use the shortest effective duration and then gradually taper the medication as symptoms subside naturally. This approach is due to the slightly increased risk of breast cancer, blood clots, and stroke associated with HRT. Typically, HRT is used within a 5-year window to minimize these risks. The second most effective treatment for menopausal symptoms is considered to be antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs. These medications can be used long-term if the individual's response is positive. Escitalopram is a well-known example that is effective in treating menopause-related anxiety and depression. Paroxetine, in low doses, is particularly effective for treating hot flashes during menopause. Antidepressants are usually used for up to 1 year. While they do not cause true dependency, abruptly stopping them can lead to symptoms such as nausea, headache, and discomfort. Therefore, tapering off the medication is the key method in this case. Vaginal estrogens, such as vaginal creams, are used to treat vaginal dryness. In terms of supplements, black cohosh is widely used for the treatment of hot flashes and night sweats. It is believed to affect serotonin levels, increasing them, and also has estrogen-like action, although study results are mixed. The typical intake period for black cohosh is 6 months, after which its effectiveness may decrease, with liver toxicity being a main concern. Flaxseed is another supplement recommended for menopausal symptoms due to its estrogen-like action, being rich in phytoestrogens and omega-3 fatty acids, and may offer some benefits in managing symptoms. Flaxseed is usually safe for long-term use. Vitamin D plays a crucial role in preventing bone loss, a concern during menopause due to decreased estrogen affecting bone mineralization. Vitamin D aids not only in calcium absorption but also in overall bone health. Magnesium is an additional supplement that can improve sleep quality, mood, and reduce water retention. It also supports bone health and strength, which are important considerations during the menopausal period. Regular exercise is beneficial for almost every aspect of menopausal symptoms, including improved mood, better sleep, stronger muscles, and bones. A diet rich in fruits, vegetables, whole grains, and lean proteins can help manage menopause symptoms. Foods rich in phytoestrogens, such as soybeans, flax seeds, and certain nuts, may offer relief from hot flashes.